All right. Hello, beautiful people. Dr. Nezio Baya here today. I wanted to talk about polypharmacy, right? When we're taking multiple medications, especially prescription drugs, and what that does, because I'm seeing this very often. I always see it, but not here in clinic so much as when people come for anesthesia for their procedures, right? And it's a big deal. What I'm saying is not just personal experience, there's studies, research behind all this showing too many of these prescription drugs or synthetic drugs in our system, increased risk of side effects, adverse reactions. You have people saying, well, they come with the allergy list that's long because now they're allergic to all these drugs. You have to realize your body is screaming out for something when that's happening, and it's not to take more of it. Okay. And then quality of life function is reduced, right? You start getting all sorts of other aches and pains and developing other things that you now need to work on. That leads us to the higher healthcare costs, not just to you, but also the healthcare system. Because now you're dealing with a side effects that's turning into some kind of illness or diagnosis. You need to see another doctor for, you need to go for another procedure for, and you might even need surgery for that you could have avoided completely. Not to talk about the increased mortality, so death rate, yes, studies have shown the more prescriptions you take, the higher your incidence of mortality will get. Not to mention just not even taking the medications that you need because of non-compliance, because of how you feel. Classic examples if it starts to affect your libido, especially for men. For women, if they start to have issues with their mood and anxiety and depression. And I know that because I've seen people start even progesterone and they get really out of whack, especially for Black women. And so causes the non-compliance. So then where are we really headed with this, right? And that's to say there's a lot of things that we can do, and that's what I'm going to talk about today. But first, talking about the case that brought this on. One of my patients, when I was doing anesthesia the other day, older lady, I see her there. She's coming to get an upper endoscopy. And I see all these drugs that she's on, but I also see ibuprofen and Motrin. And I'm like, okay, why are you taking that? That's over the counter. She's like, well, I get sore. Why are you getting sore? Well, when I work out or do even a little bit of movement, I get so sore. It's so painful. I can barely move. I need to take it. And then I'm seeing right there on her prescriptions too that she's also on statins, right, which are the cholesterol lowering medications. Atorvastatin is one of them. And she's taking that. And that has been shown to have side effects of myalgias like muscle pain, muscle weakness, right? But not only that, other things I have seen with that is mood changes, personality changes, depression. And I've seen that not only with patients, but even family members, where depression would set in from starting that because the cholesterol lowering effect is not just in like the arteries or whatever they're trying to get, it also happens in the brain where you actually need that fat and cholesterol to get your neurons and your nerves firing for the brain to work well. So I've seen that happen as well. So that being said, with her, she's taking that, that's creating the myalgias and muscle weakness and muscle pain, and then taking ibuprofen and Motrin every time she moves or exercises, that now she's having inflammation in her gut and in her stomach. And now she's here getting a procedure where she needs to take a day off. Husband or whoever's coming has to take a day off. There's deductibles that it's going to take out of, or even out of pocket expenses that it's going to cost, and all that could have been avoided. And so I see that all the time. And I'm big on detox. And detox is not always about doing herbs. Yes, I do therapies. The diarrhea thing when you detox is a myth. You don't need to. But it's not just about that. It's about looking at what you're on and taking out what no longer serves you, right? And so for her, making sure that she can switch to something more natural. And I hear some people say, doc, I just take it once a month for my period or when this is happening. Even that on a recurrent basis with these NSAIDs, which is your Motrin, ibuprofen, and all that, will still tear up your gut, will still cause inflammation in your body. It's not inflammation, but in your gut lining, it will cause the gut lining to be impaired, leaky. We see that all the time when we do these procedures for these young women. And I'll talk a little bit at the end about what you can substitute for that. But to be mindful of this, that you don't stockpile your prescription list because you're dealing with a side effect from a prescription or a drug that you're already taking, especially for things that can be mitigated and improved with lifestyle and with supplements. Because one of the things with supplements, as much as I don't want to just use a supplement as another band-aid, we want to get to the root cause. But a lot of times supplements just don't help with just pain. they have other, I call it great side effects for healing the body, right? And one of those that I recommended for her to use instead are things like turmeric and boswellia, right? Turmeric is great for pain. It's shown clinically research too, both turmeric and boswellia for pain, inflammation, but even neuropathic pain, nerve pain, especially with the boswellia too. And we have those combinations here. And you want to get those in pill form so you can get the right dosages. As much as I'm not an advocate for foo-fooing on Amazon with supplements, because I have shared videos where they've actually checked these supplements to either have fillers, not have the ingredients that are posted on it, because these things are not regulated. So if you really want a good one, go to a practitioner like me that does functional medicine, natural medicine, that has products that they know work for people that you can get from them. And if you want to get one from here, we have our Bosman Gold that we use for that. But getting supplements like that would help. And again, it's not like, okay, I'm having pain, I'm going to take this right away. These supplements sometimes take some time to build up in the body. Okay, so you want to take it on a regular basis. Okay, but also because things like turmeric have other great side effects with reducing inflammation, cancer prevention. Okay, all again, all clinically researched to say that does work on that level for people. So you can do that instead. And then when it comes to the cholesterol lowering drugs, there's lifestyle, there's changes you can make. Yes, there's supplements we do too. I always try to start with lifestyle first, and I'm usually over 90% successful at working on the cholesterol levels just from there, right? Um, and all that to say, watch what you're doing with not just prescriptions, because people do certain things with supplements, especially if your cabinet is filled with all the stuff you're pulling off of the internet and you don't even know why you're taking them and you don't even take them well. You probably need to come see me. But watch out for piling on prescriptions and start to ask yourself, why am I taking it? What is the root cause of this? How long am I supposed to be taking this for? What is it mitigating or improving in my system that I cannot do on my own or with something more natural that will have less side effects for me? Because again, poly supplements is not shown to cause any of these things that polypharmacy with prescription and synthetic drugs cause because they're not as biocompatible with our systems, with our bodies, right? And so keep that in mind. All right. I wanted to come online to share that. Look out for my next two posts that I'll be sharing. Very important around hormones. It's a lot with testosterone, especially with men. And they're very simple things you can do at home that'll get a big effect that a lot of people are not looking at. A lot of times you see that there are big things you can do. I do a lot of that in clinic, but I'm sharing with you the little things that you can do at home to get yourself situated. So that's one. Two, a lot of women with these fibroids, a lot of especially Black women having issues when they go try hormone therapies out there because our bodies are different, right? I had someone recently letting me know about a friend that started and ended up in the psych unit. So those are things that I want to kind of touch a little bit on to kind of give you some leeway on where you are and where you might need to go to get more help, more strategic, effective help. All right. Have a wonderful, blessed day. One love. Ashe, Ise.